I would like to give you some examples without giving the names. In some place, healthcare workers went to test some individuals, and they came as a mob, and they chased the healthcare workers and hit them. The place. In another place, where a COVID positive patient died after all the efforts given by the healthcare professionals, the family came and they ransacked the hospital and they hit the doctor. And doctor had to get admitted in the hospital for the treatment. And yesterday, a doctor who was treating patients had unfortunately contracted the COVID infection, and he fought for his life. Unfortunately, he died yesterday, and people did not allow his body to get cremated in the burial ground. If people are so scared, not to allow even the body to pass through the road, thinking that they would contract the infection, how should healthcare professionals think? Yesterday, we had to sit by a patient, COVID positive patient, who was fighting for his life on ventilator. We had to spend more than 2 hours time along with the ICU team just to stabilize that patient. I know many times people just post messages saying, "We salute doctors, you are great, you are the real heroes, you are the real warriors." Well, this is what is happening with the real warriors. When a soldier dies in the war, his body is brought back. They cover his body with the Indian flag and they give him due respect. And here, the bodies of doctors are being buried and cremated like those of orphans. Please put yourselves in their shoes. What would the family think? What would the other healthcare providers think? What would we all, who are all, day in and day out, who are working with these so-called COVID patients, what should we think? There is no point in thinking that, police or government should do something for this. There is a saying, bad things happen not because of the actions of bad people, but because of the silence of good people. When we feel that, whatever happens outside is not our concern unless it comes and falls on our shoulders, it will one day fall on our shoulders. COVID is a best example for that. If such things go on happening for healthcare professionals, just think what will happen to their morale. Where is the motivation to work? Why should they work? If the healthcare professionals break down, if they give up, what will happen? I think this is the time everybody should think deeply about it and then see how you can help them. Thank you.